If you're on food stamps or social security benefits, listen up. I have 4 updates I need to share with you that has information you don't want to miss. So let's get right to it. So, food stamps beneficiaries, your checks are coming up in a few days. There's states are issuing EBT benefits up to $1,756, and I'll tell you which states and in what order. And then, if you're on Social Security or you are in retirement, this is important information. 40% of seniors are returning back to work due to the low cost of living adjustment that was just announced. I will tell you all about it. Plus, I'll share with you a story of one baby boomer living on $1,470 in monthly Social Security benefits and is returning to work. Actually, she has returned to work, and I'm going to tell you why and the challenges she's facing living on Social Security and trying to make extra money to make ends meet. And then I want you to stay till the end of this video because I have 20 financial assistance programs targeted at seniors, low-income seniors, that a lot of people are actually not taking advantage of that they should. And I think the biggest reason is that people don't know that these programs exist. So I'm going to walk you through each of the 20 programs that offer financial assistance benefits to seniors. So if you are new to this channel, please hit the subscribe button, hit the like button, because we want as many people as possible to see this video because it has critical information that's going to benefit a lot of people. So let's get started with food stamps benefit payments. Each month, states issue food stamp benefits to eligible beneficiaries based on their own schedule. Up to $1,756 in payments is coming in the next few days, and I'm going to tell you who is eligible and how much the maximum benefit is based on household size. So here's the schedule, and I've broken it down into several categories. There are states that issue that benefits the 1st of December. You have Alaska, North Dakota, Rhode Island, Vermont, Virgin Islands, and then you have New Hampshire issuing on December 5th and South Dakota issuing on December 10th. Then there are those who issue within a very short window, the 1st to the 5th of the month. That's Connecticut, Hawaii, Nebraska, New Jersey, and Wyoming. And then other states are issuing benefits on the first 10 days of the month. California, Colorado, D.C., Guam, Idaho, Iowa, Kansas, Oklahoma, and Nevada. And then you have Utah issuing on December the 5th, December the 11th, December the 15th. There's more. During the first 2 weeks, the following states are going to issue EBT benefits: Arizona, Maine, Massachusetts, Pennsylvania, Virginia, and West Virginia. And then up to the 20th of the month, you're going to have Illinois, Kentucky, New Mexico, Ohio, South Carolina, Tennessee, and Washington issuing benefits. And then up to the 23rd of the month, you have Alabama, Delaware, Georgia, Indiana, Maryland, Michigan, and Mississippi issuing benefits. And then up to the first 28 days of the month, you have Florida and Texas issuing benefits. Now, how much are you likely to get? Well, I told you that up to $1,756, that's for a household of 8 members. If you're a household of 1, the maximum benefit you can get is $292. Sorry. If you're a household of 2, it's $536. If you're a household of 3, $768. If you're a household of 4, $975. If you're a household of 5, $1,158. And if you're a household of 6, $1,390. Now, this is the maximum benefit you can get. How much you would get and your family would get depends on your individual situation. So if you're a family of 4, the maximum you can get is $975. But your family may get less based on how much money you're making and how many people are in your household and how much your net income, which is used to calculate food stamp benefits, what it falls to. And so you have to know that your individual benefit may not necessarily be the maximum, but at least you know how much you can get, the top level of benefits that you can get when it comes to food stamps based on your household size. Food stamps helps 42 million people. Still, 42 million people are on food stamps right now. And they get their benefits through EBT on a monthly basis. You can use EBT to buy approved food items at approved location, and the goal is to fight poverty. The program is run at the state level by states' food stamp agencies, and it is supervised, or the agency that runs it at the federal level is the U.S. Department of Agriculture, that sets the rules and standards for the states to follow. And monthly distribution schedules vary by state, as I have already walked you through. And the main goal, as I mentioned, is to help fight hunger and food insecurity and promote healthy nutritional options for people on low income. You can use your food stamps benefits to buy fruits and veggies, meat and poultry and fish, dairy products, bread and whole grains. You can use it to buy seeds and plants that produce food, cereals and staple food items. And, of course, you have to use your benefits to buy food that is for home consumption. So you cannot use your food stamps benefits to buy hot food unless your state participates in the restaurant meals program, which is currently in about 9 to 10 states. It is a program that helps those who do not have access to kitchen, or have a disability, or have an inhibition that prevents them from preparing food, to be able to use their food stamps to buy food at restaurants. To be eligible, you have to be over 60 years old, or you have to be disabled, or you have to be homeless. Those are the three categories of people that qualify to use their EBT to buy food at restaurants. However, you have to live in a state that offers the program. And as I mentioned, there are about 10 states: California, Arizona, Maryland, New York, Michigan, Rhode Island, and I'm missing a few of them, but it's about 10 states that offer the program. And so if your state is one of them, then you can apply to be approved to use your benefits to buy food at restaurants. Otherwise, everybody else, you cannot use your EBT benefits at restaurants. You cannot use it to buy alcohol, cleaning supplies, vitamins and supplements, prescription medications, pet food, and personal items. Now, let's talk about this retirement crisis that is brewing, that I think every senior to pay attention to. So, a lot of seniors are returning back to work. Up to 40% of seniors are going back to work due to the low COLA increase. As you may know, the Social Security Administration just announced the cost of living adjustment for 2024, which will go into effect in 2025. And that is causing a lot of seniors to rethink their retirement plans. And this is happening all over the place. And this is from the National Council on Aging, addressing the nation's retirement crisis. Today's 65-year-old can expect to live another 20 years. According to the Social Security Administration, 80% of households with older adults, or 47 million of such households, are financially struggling today, or at risk of falling into economic insecurity as a result of age. This is from T. Rowe Price, also in 2024. And retiring, why retirees want to go back to work. Millions of retirees have returned to work in search of financial and emotional benefits. Half of retirees are considering return to work after a COLA update. This was October 2024. This is from Newsweek. It means that the recent COLA update of 2.5% increase is causing a lot of people to rethink their retirement, because cost of living has gone up and stayed up, and a lot of seniors cannot afford to pay for the basic things that they need. And so this COLA increase was kind of a gut punch. And so a lot of them are thinking about their plans. Here's another one from a local TV station in Cincinnati. Retirees are returning to workforce in droves, and here's why. And retiring is the hardest trend among seniors. And it talks about the fact that many retirees in their 60s and 70s are returning to work, and explains why. And I'm going to tell you why with a story that I'm about to share with you from somebody that has returned to work and has shared their story with Business Insider. This is from 2022, and it looks like this is when this trend started, but it has accelerated recently, and that's from the New York Times. And then Resume Builder did an in-depth survey and found that 1 in 8 retirees plan to go to work in 2025. This is from September. And here's the kicker. 13% of retired seniors say they are looking to start working next year. The top reason for retirees returning to work is increased cost of living. That should not be a surprise. And here's another data that's shocking. 4 in 10 working seniors were once retired. So if you take 10 seniors right now that are working, 4 of them used to previously had retired and then had to go back into the workforce because mostly for financial reasons. So this is another data point from Resume Builder, and you can see the seriousness of this crisis. Why are retired seniors going back to work? 68% says its cost of living increased more than expected. And you have another 38% saying to afford rising housing costs. And then another 35% to help pay debt other than medical debt. So a lot of seniors are returning to work due to financial reasons. So having said all that, let's dig into one person's story that highlights what's going on. A baby boomer living on $1,470 monthly on Social Security returned to work to support her children and grandchildren, and she says, I try to help as much as I can. So who is this person? Let's dig deeper. So this is Pamela Shields. She's 67, unretired, to supplement her Social Security income with part-time jobs with an S. Many older Americans say monthly Social Security checks aren't enough to pay their bills. An analysis found that 13% of retired baby boomers on LinkedIn returned to work in 2023. So, what is Pamela's story and how can we learn from that? Pamela Shields exemplifies a growing trend of unretired Americans at age 67 challenging traditional retirement expectations. Her monthly Social Security check of $1,470 falls short of covering basic living expenses. The Fort Worth, Texas resident who represents millions struggling with retirement income. Part-time jobs have become necessary for survival, showing the gap between Social Security benefits and actual cost of living. She works night shifts at a grocery store that requires physical stamina despite her age-related challenges, and she provides caregiving services to elderly neighbors, and that creates additional income sources. So the 2 jobs that she has give her a modest $600 a month as supplemental income. 7 days a week she works, and it's taking a physical toll on her through ongoing foot pain during shifts, highlighting healthcare challenges. So how did she get here? Well, she built a solid foundation through her career in customer service and human resources, responsibly established 401k retirement savings during her working years, but she faced some financial setbacks. The first one was 2 divorces that significantly reduced her savings, and then unexpected medical expenses drained the remaining resources. A lot of seniors have medical debt that kind of wipe out their savings. Career cut short by devastating car crash injuries, forcing her retirement at 59 years old, and demonstrate how life events can derail even well-planned retirement strategies. She's providing ongoing financial assistance to her adult children despite limited resources. She houses and supports her daughter dealing with chronic health issues. She contributes to her grandson's education through marching band fee assistance. Regular grocery assistance to family members strains her fixed income, and she manages personal expenses including housing, utilities, and communication costs. And she's part of what they call the sandwich generation of people in their 60s who now have to deal with caring for their own children and their grandkids, and then having to deal with their adult parent themselves. They may have 1 or 2 parents, both still living, probably in their 80s and 90s, and they have to take care of them too. And that is straining a lot of people's resources. Research reveals 20% of Americans over 50 have zero retirement savings. Wow. LinkedIn data shows 13% rise in unretired baby boomers returning to workforce. Social Security benefits increasingly inadequate for basic living expenses, and a growing trend of seniors forced to choose between retirement and survival, economic pressure forcing lifestyle adjustment for entire generation. So here's the reality. Medicare provides essential but incomplete health care coverage. Her early retirement at age 59 resulted in reduced monthly payments, monthly Social Security benefits, and combined monthly income of $2,070 from her Social Security benefits. And because she retired at 59, she may have been able to get a widow's benefit early, because the minimum age you have to retire for Social Security benefit is 62. But in addition to her Social Security benefit, because she retired early, she's getting a reduced benefit. And combined with her $600 in part-time jobs, 2 jobs, she's making $2,070 and barely covers her necessities. Her continued employment is necessary for the foreseeable future, and this pretty much demonstrates the gap between retirement benefits and actual cost of living. So, critical lessons we can all learn from this. Early financial planning is crucial for early retirement. Essential for you to have a comprehensive education on financial planning. Life's unexpected challenges can quickly deplete retirement savings, so that is something you need to think about. Medical expenses remain a major threat to retirement security. Social Security system may require supplemental income sources. And importance of building multiple streams of income. Amen. I think everybody needs multiple streams of income to survive in today's world. That's just the fact. And traditional retirement may no longer be viable for a lot of Americans, which is very, very sad. So I want to hear from you. What do you think about this situation? What do you think about Pamela's situation? Have you faced similar situation? Are you planning to return to work? Are you already back to work? Or are you delaying your retirement because of all these challenges? Let me know in the comment section. I want to hear from you and see what you think. And then next, if you've stayed so far, you're going to get great information, because I'm about to share with you 20 financial assistance programs that every low-income senior needs to know about, that you may not necessarily know about, that could change and save you a lot of money. So let's get right into it. All right, so let's get started. The first one is Senior Community Service Employment Program. It provides job training and part-time employment for seniors. It focuses on community service role. And here's the kicker. You are eligible to get income. Eligibility is 55 plus, and you cannot make more than 125% of the federal poverty level to qualify. It helps seniors stay active and earn income. Go to the website below and get details. The second program is Tax Relief for Seniors. Includes federal elder tax credit for seniors with limited taxable income. State programs may offer relief on property sales or income taxes. Renters can also benefit in states with renter-focused tax assistance. Program eases the financial burden of annual tax filings for seniors. Visit your state's tax office or consult a tax advisor for details. The next program is the State Pharmaceutical Assistance Program. Helps cover medication costs, filling gaps left by Medicare. Available in several states with varying income limits. So you have to check with your states to get a specific income limit for your state. It works along Medicare Part D. Visit your state-specific SPAP website for eligibility info, or go to the website below for more details. The next is free and discounted transportation programs, non-emergency transportation to medical appointments and community centers. Programs like Access a Ride or Dial a Ride cater to low-income seniors, often funded through local transit agencies and senior centers. Eligibility varies. Proof of income or age may be required. Contact your local area agency on aging for more details. Next is Section 202 supportive housing. This is something that a lot of people don't know about. A lot of people know about Section 8, but do you know about Section 202? is subsidized rental housing for seniors with low income. It includes on-site services such as transportation and meals. Rent typically does not exceed 30% of seniors' income. Eligibility is 62 plus with limited assets. You can apply through HUD-approved agencies, so go to the website below for details. Number 6, low-income home energy assistance program. It pays for heating and cooling costs, reducing utility for seniors. Weatherization services provide improved home efficiency. You have to make less than 150% of the federal poverty level to qualify, and offers crisis assistance for energy shut-off emergencies. Apply through your state's energy assistance office. Next is Silver Sneakers. This is a great program for seniors who want to stay active. Offers free fitness program through Medicare Advantage plans, access to gyms, online classes, and wellness programs. It's focused on maintaining physical health and reducing healthcare costs. So check the availability or eligibility with your Medicare provider or plan administrator, or go to silversneakers.com. Number 8, low-cost internet for seniors through the Lifeline program. Offers discounted on internet and phone services. You have to make less than 135% of the federal poverty level to qualify. Averages about $9.25 a month towards your internet or phone bill, and focuses on helping seniors with digital inclusion. Go to lifelinesupport.org for more details. Moving on, state property tax relief offers tax exemptions, deferrals, and freezes specifically for senior homeowners. Helps reduce or delay property taxes to protect home ownership. Eligibility varies by state, often requiring proof of age and income limits. Focus on seniors remaining in their homes without financial strain. Contact your local tax assessor's office or your state tax office to get what is specific in your state. The image I've shown here is for a state of Montana. They have property tax assistance program. So I wanted to give you an idea of what could be possible in your own state. So contact your state's tax agency or assessment office to find out what specific tax program or exemptions they have to support seniors. Next is Medicare Savings Plan, which assists with Medicare premiums, deductible, and co-insurance. Includes programs like QMB, the Qualified Medicare Beneficiary, or SLMB, the Specified Low-Income Medicare Beneficiary programs. Income eligibility, you have to make less than 135% of the federal poverty level, and save seniors an average of $1,600 annually in healthcare costs. This is serious, guys. If you haven't heard of the Medicare Savings Program, check it out in your state. Contact your Medicaid office because this program can save you good money. Number 11, Supplemental Security Income Energy Assistance. There are some seniors that are on SSI benefits, which automatically qualifies you for energy bill assistance. You have to contact your local utility, or you can combine this with your state's energy assistance program to even get more savings. Obviously, there are eligibility income requirements. Most of the time is 175% or less of the federal poverty level. And I'm showing you a program from Ohio that is offered by the state of Ohio to help with home energy assistance. So check with your own state for more details. Number 12, the Senior Farmers Market Nutrition Program. This program has been around for a long time, offers by the USDA and run through the states. So this one I'm showing you, the picture you see is from North Carolina, but each state has its own program. Offers vouchers to purchase fresh fruits and vegetables, honey and herbs, accepted at farmers market, roadside stands, and community farms. You have to make less than 135% of the federal poverty level. And the whole goal is to encourage healthy, locally sourced food options for seniors. So visit the website below to get more details. Number 13, Community Supplemental Food Program, CSFP. This also has been around for a long time. It provides monthly food boxes, includes staples like grains, canned vegetables, and dairy. aims to combat food insecurity among low-income seniors 60 plus. You have to have less than 130% of the federal poverty level to qualify, and food is distributed and managed by a local USDA agency. So contact your local USDA office or visit the website below for more details. Supplemental security income. Did you know that seniors that are on low income, if you're getting a small social security benefit, you may be eligible for SSI. It's a monthly payment for low-income seniors age 65 or people with disability. The cap is $967 a month, and if you're a couple, you can get $1,450. Some states even add additional money to SSI benefits to give you more money. And as you can see from the chart that I've provided, 2.1 million seniors are on SSI benefits. 25% of the total number of people that get SSI benefits are seniors. So do not sleep on SSI if you are on low income as a senior. Next, we have reverse mortgages. Now, this one, I'm going to tell you, comes with a lot of warnings. Before you even touch reverse mortgage, talk to a financial advisor, talk to a HUD-approved specialist and counselor before you touch this. It converts your home equity into cash for senior use as needed, does not require repayment until the home is sold. You have to be 62 plus, and it provides financial relief without selling your home. However, you could lose your home. Failing to pay property taxes, homeowners insurance, or maintain the home can lead to foreclosure. Reverse mortgages have upfront fees and interest that accumulate over time, reducing the equity left. If you want to leave some money to your children, grandchildren through your home, getting a reverse mortgage is going to severely limit that. So keep that in mind. Meals on Wheels delivers nutritious meals to homebound seniors, prioritizes those unable to cook or shop due to mobility issues. Volunteers visit, offer social interactions and wellness checks alongside food. Eligibility and fee vary by program. So go to mealsonwheelsamerica.org to get more information. Next, housing vouchers through Section 8 subsidizes rent for low-income seniors, ensuring they pay no more than 30% of income on housing. Prioritizes seniors, disabled individuals, and families with children. Eligibility, 50% of the area medium income. So whatever the medium income is in your area, you have to make less than 50% to qualify for Section 8. There's a long waiting list for obvious reasons, so apply early, and you have to apply through your local housing authority, or go to this website that I've shown for more details. The next one is Aging and Disability Resources Center. Connects seniors to state, local, and federal benefits and resources. Services include care coordination, healthcare navigation, and housing assistance. It's designed for those needing long-term services and support. They also provide free consultations by trained staff. So go to your local agency, the Aging and Disability Agency in your area. As you can see, I've provided an image from Brown County, Wisconsin. These agency offices are all over the place, so find one in your local area, visit them in person, and just learn about what they do and ask questions of how they can help you get access to local, state, and federal benefits in your area. Medicaid. Medicaid is health care for people on low income, and that includes seniors. So comprehensive health care coverage, including doctor visit, hospitals, and nursing home care, covers in-home care and long-term care services for qualified seniors. You have to make less than 138% of the federal poverty level to qualify, and dual eligibility is possible because you can be on Medicare and get Medicaid if you are low income, and qualify for Medicare because you are 65 and above, but you're low income, so you get Medicaid to cover things that you cannot afford to cover. Visit medicaid.gov for details. And then lastly, food stamps. I saved this for last because I wanted to talk to you about it. 50% of seniors that qualify for food stamps do not apply because some of them are ashamed, some of them are misinformed. If you're eligible for food stamps, if you qualify, you will get it. Now, a lot of seniors say, oh, I only get $23. Well, here's the thing. $23 may not be enough, and it's not. I'm not saying it is. But apply anyway and get the EBT card, because that EBT card helps you become eligible for a whole host of other things. You get 50% off on Amazon Prime. You get 50% off on Walmart Plus. You get free admission to a lot of museums across the country. And so many benefits that I've talked about in videos that you have to look for in the library. So, yes, apply for food stamps. You may not get a lot of money, but it's worth something. But then the EBT card itself can help you get a lot of discounts that makes it worth getting the food stamps. So that is my advice. And I want you to tell me, which of these programs that I've talked about have you used before? Did you know they existed? Which one do you plan to look into tomorrow? These programs are available to you. There's no reason why you shouldn't be looking through them, especially if you need help. So let me know in the comment section if there's a particular program you're looking into right now. And finally, if you're new to this channel, hit the subscribe button, hit the like button. We want this video shared with as many people, so please do share it with people you know will benefit from this information. And until I see you in the next video, thank you for watching.